German Chancellor Angela Merkel is preparing to address Parliament to defend the decision to extend the country's current coronavirus lockdown until at least March 7th. These are live pictures you're seeing here from the Bundestag, where the Chancellor will shortly be outlining her government's strategy to combat the coronavirus pandemic. Although certain restrictions will be relaxed earlier, Chancellor Merkel has made clear she fully supports extending the lockdown beyond February. The number of deaths and new infections in Germany has been declining recently, but Merkel says the new variants of COVID-19 remain a serious cause for concern.
As the sun went down behind the Chancellery in Berlin, another showdown about the lockdown. Merkel and the state premiers wrestling with the question, given the advance of coronavirus mutations in Germany, how soon will it be possible to open up?
The
time between now and the middle of March is when the experts are telling us that the mutated virus could gain the upper hand over the initial strain. It's crucial that we lower the infection rate.
And we interrupt that and go straight to Angela Merkel addressing the Bundestag.
Our country needs to be steered through this disaster and into calmer waters. Since the outbreak of the pandemic, we have jointly tried to stand against the virus. It is a national effort. It's something which we all are touched by, old, young, adults, children, rural, urban areas, politics, administration, culture, sports, churches, everybody, all our lives and the way we live together are affected. In this year, we have, all of us, learned how the virus works and what works against it. Learning doesn't mean one gets it right from the word go. To correct something one has done once is part of it, as we have done with our mask-wearing recommendation. But that is why I say, even if we're in a difficult phase right now, where many people feel that they really can't stand it for much longer, that is the very reason why I say, in this year of the pandemic, we have already gone past a lot of this very difficult path. And we have tried all we can not to overburden our health system. It was a maximum stress for the people in the nursing care sector, for medicine, for ICUs. Yes, that has existed and still exists, unfortunately. And we simply cannot thank all the healthcare professionals for all their commitment. But we have been able to avoid overburdening our health system, thank God. Somebody who has to be taken to hospital with a severe coronavirus infection will get the treatment he or she needs all over Germany. And in many places of the world we see how often this cannot be stated as it can here, and we can be happy about it here. And so I'm saying that what we've achieved together in combating this virus has been something we've been paying a high price for and continue to pay a high price for. So I'm absolutely clear about what these necessary measures mean for every single one of us here in Germany. It's a restriction of freedom which we haven't seen in this country before, a personal restriction of freedom, personal stress, loneliness, economic problems, fear for one's very existence. These are things which I will not forget one single day. All these measures have been decided with our democracy. The decisions are legitimate, yes, but I'm also aware that as a democracy, it is up to us to keep these restrictions only as long as necessary, not one day longer, and to lift them when possible. And that is exactly the objective of this government, and I am aware also the objective of the Parliament. Ladies and gentlemen, I spoke of what we have achieved together. This also means that the first wave of the pandemic in the spring 2020 is something which hit Germany far less harshly than many other countries in Europe and the whole world. Following on that, there was a summer where, looking back, life began to be much easier with incidence rates that are dreamlike, looking back. 3 or 4 infections over 7 days per 100,000 inhabitants. Then, and this is one of the lessons learned, we weren't sufficiently cautious and not fast enough. The indications of a second wave and the warnings coming from different scientists weren't heard early enough, and we didn't act quickly enough to curb public life. On the 26th of November 2020, we came to a decision after weeks of dramatic exponential growth in the number of infections. That steep growth curves, we were able to get that one down, but until the beginning of this year, the virus spread too fast and in far too uncontrolled a way. I'm sure it's a consequence of the more hesitant approach we had in the end of summer and beginning of autumn. Today, as far as infection rates are concerned, we're looking a lot better. The necessary trend reversal, which I had hoped for at the end of November, has been achieved. The number of new infections has been going down for a fair time, as has the number of active COVID cases and the number of COVID patients in ICU beds. And with all due caution, I say that even the worst, the saddest of all the numbers, namely the number of people dying every day of the COVID virus, that number seems finally to be going down as well. At least we are not achieving high points anymore. And these people who have died by now, more than 60,000. There are mothers, our fathers, our children, friends, relations, those we could not save, mourning them and the ones they leave. These are matters we always have at the backs of our mind when we make decisions, and we owe it to them. Now we have a situation which I could only hope for when I last spoke in this House, but which wasn't certain. Now the vaccination possibility exists because the vaccines have arrived. This is something which, thanks to brilliant scientists, has been achieved in record time. We've decided for a European path, negotiations, joint procurement and no emergency marketing authorizations, and I stand by that. Since the end of the Second World War, we Europeans stand together politically and also ideologically. Everywhere in the European Union, vaccinations have started. No country, however small or economically less powerful, needs to wait. We have got guarantees for how much vaccination we will buy. This has made it possible, particularly through the guarantees given by Germany, for companies like BioNTech to start producing to the scale they've produced. And, of course, ladies and gentlemen, I'm aware that many people have been disappointed by the stutter start because their hopes are so huge. And every one of us, including myself, personally hope for this. At the beginning, certain amounts were agreed on, but then comparatively fewer doses were made available. Despite the situation, we had to make decisions which were very difficult. And we have a vaccination commission which advises us. On the basis of that advice, we decided first we would inoculate those most in danger, old people, people in senior homes, care homes, and the doctors and nursing staffs, looking at them and at COVID patients. Today, more than 80% of people in care homes and more than 1 million people in the medical profession have received at least the initial injection. That's very important because it does provide a lot of protection. Every week, every month, millions of additional doses will become available, and more people will receive protection so that by the end of the summer, anyone who wishes will receive the vaccination. That is a target we have set on the basis of the vaccinations made available for those manufacturers who've already achieved marketing authorization for their products. So it can be achieved. And we stand by it. At the beginning of the negotiations, we had made financial commitments to the manufacturers of the the vaccines, and we will continue to support them whenever possible to find new production facilities in order to really increase production, which is very important, particularly when we're looking at virus mutations. BioNTech has only yesterday started producing their vaccine in a new facility in Marburg. The German government has set up a task force on questions of vaccinations, and that will meet on a regular basis. So vaccination is getting a greater impetus. Infection rates, deaths are going down. There are many important indicators. And if this were all, then you would see me, despite the difficulties, looking quite optimistic. But even though not quite visible, we see more and more clearly emerging one danger, which is a danger for the very good way in which we are. And that's a very real danger, namely mutations of the virus. Mutations which have manifested themselves in such a way that they have led to much more aggressive virus strains. It had to be expected. And in the future, there could also be unfortunate developments like this. Now we're dealing with 3 relevant mutations: the British mutation, the South African, and the Brazilian one. And the British one is most widespread even here. Not all the research has yet been finalized, but we'd be well advised to listen to what so many experts, both in Germany and abroad, tell us. We shouldn't doubt when they explain that all these 3 mutations are significantly more aggressive, more transmissible, more infectious than the original virus. And as is always the case with a virus, because of their properties, these mutations will sooner or later become the dominant strains, as has already happened in some European countries. And we hope that in time we will be able to combat the dramatic effects we have seen through the mutations, with dangerous repercussions for the health sector. In the last week of January, we've seen these mutations already taking something like 5.7% of all cases, but new data are going to be available soon. The most frequent of the mutations in Germany is the English variant, and experts tell us it's only a question of time until these mutations will become the dominant strain and will crowd out the original virus. And that is something we need to prepare for, despite the incidence rates going down as they are at the moment. We still need to be aware that underlying this situation, there is a new variant of the virus emerging, so we have to be extremely cautious that we don't get into this exponential growth spiral again. Yeah, it may be something you don't like hearing, but we have to live with reality and find the right answers to it. What will help us? Well, we have a situation where the vaccination campaign and the vaccination rollout is gaining speed, but in the forthcoming months it's not going to give us sort of collective protection, but individual protection. Many people expect that the time has come to show very clear easings, openings. And we know that the danger of mutations may well destroy any success, because then we could see the R numbers going up and exponential growth may happen again. That was the position we were facing yesterday when the federal and the regional governments met. Together, we looked at this difficult, contradictory situation, which we were well aware of. And given this backdrop, we agreed on measures to last until March 7. Most of the restrictive measures will have to be consistently applied. It's time and again social distancing, reduction of contacts by limiting private meetings to 1 household plus 1 additional person, making sure that bearing the medical masks which are now available in public spaces, in public transport, everywhere inside a home, like in the German parliament. And that's very true for places of work, as long as more than 1 individual is in a room. Also, visits from and to relatives should be avoided. And working at home, that is what we should do as far as possible and wherever possible. And let me appeal once again to the employers. Working from home, WFH, that's a tried and tested way of reducing contacts, because private households can do a lot to combat the pandemic. And so let's make business it possible for people to work from home wherever it can be done. Of course, expectations regarding yesterday were less what will we keep in the way of measures, but what will we change? We all agree that the priority is schools, childcare facilities, because the repercussions of weeks of closure of all these facilities are there and they are noticeable. The stress for parents is also significant. Despite this, what I would have liked to see is that we decide on the basis of the incidence rate. But I had to accept that there is the authority of the regions, and they have the right to decide on educational matters which are there in their authority, their jurisdiction. So it's the Länder in Germany, the regions, they will decide what to do within their jurisdiction. Some schools will open probably next week, others on the 22nd, but only primary schools and child daycare facilities, blended learnings, plus very strict hygiene measures. Well, ladies and gentlemen, we discussed another reopening. From 1st of March, hairdressers will open. We have good prospects. We have good prospects for 1st of March that we can achieve incidence of 50 nationwide. Today the incidence rate is 64.2 on the basis of what the Robert Koch Institute is saying. And on that basis we discussed further reopenings. This is the one thing which is of the greatest interest for people. And let me say expressly, and I really support the fact that when it comes to further openings and reopenings, we've decided on the basis of these new mutations not to give dates, but infection rates, in other words, incidence. And some people will say, well, that doesn't give me the planning certainty I need. But we are battling a virus. The virus is our opponent, and the virus doesn't go by dates, but by infection rates and question of how an infection is spreading. And that's why any further reopening has now been set for an incidence rate of 35. Some people say, well, where did you come up with that number from? And you know that the incidence rate of 50 was in Section 28A of the Infection Protection Act, after which far-reaching measures can be decided as well. And we're talking about 35 now, so that's further-reaching measures after that. So the incidence of 35, that's the point when I can go to some reopening. And we've decided that reopening should be retail, trade, galleries, museums, and services which require close physical contact. And I think this is the right prospect to open. And the question is, what will be the next steps towards easing restrictions? And I can tell you the following. Yes, federal and regional governments will deliberate about this, and we have given the various areas which may be possible. It's also a question about reducing contacts in the private sphere, and we'll have to also address the question of what to do with older school-age kids. Sports in groups, leisure time activities, and after that the gastronomy sector and hotel business. It's going to be a staged process. And speaking today, we cannot say yet, at least as far as I'm concerned, what we'll be able to do when incidence rates are such or such. We have to look at incidents, have to look at what we're doing, how far we're getting with our COVID warning app, how we do with better equipping health authorities, more testing and improved testing, better protection measures. All of that will allow us to ease restrictions without risking another exponential growth spiral. And I can tell you my target is that any new wave that might happen, if the new virus strains become dominant, we mustn't give that room. We mustn't end up with another two-digit exponential growth. We must do everything we can in order to keep control of contact tracing, because only then will we not kickstart a third wave. But that also means we have to be extremely cautious. I do not believe that toing and froing, opening here and closing there, is something which allows people to be clear about the situation, then to wait a bit and then have a continuous, slow process of openings. And that is exactly the sort of tension which we all feel in our lives. I feel that just as much as you can. You can believe that. I mean, who wouldn't like to give you good news? Everybody knows, as I said at the beginning, how much people are suffering from this. Despite this, I believe that yesterday it was the right thing to do, to say first schools and hairdressers, and childcare facilities, and then concentrate on incident rate as a prerequisite for further openings. And that's what we will do. I think we have come to an agreement as necessary and also proportional. And there is nothing else that we can do than consistently reduce contacts in all areas in order to sustainably reduce the infection rate and get it to a level where we can master what is happening and to keep it there. I think yesterday's message was important, and we were all very interested and happy to see that the applications for the bridging assistance type 3 can be submitted as of yesterday. I know that lots of people are waiting for this assistance, for this funding, and I know how many people haven't got liquidity. I know that the retail trade is suffering, as are many others, but let me also say one other thing. The Minister of Finance and the Minister of Economic Affairs have both promised that from February applications can be submitted and that these applications will be answered by lump sum payments from March. Today is February 11, yesterday was February 10. What we promised is something we keep to, and despite that, it's been a very, very long time for the people affected, and I'm glad that we've got to the situation now. This was a very important step. Mr. Speaker, colleagues, ladies and gentlemen, this is a hard winter outside and also when it comes to our lives. But we have a much clearer idea of what the target is. We aren't that far removed from an infection rate which would allow a staged opening, slightly more freedom. Because we can contact trace and trace the infection rate, because we have managed to prevent the hospital system being overburdened. Now we have to continue our efforts until March 7. Try to keep the mutations to a small scale and hope that the 7-day incidence can be pushed to below 50. From my angle, that is worth our efforts. It's always about making sure we have continually reducing numbers. We need to persevere. We need to show patience. And I know that on a day like today, that is not an easy thing to do. But people can rely on a state, on a government, which will do what is sensible, what is possible to help those in need, so that they too can survive this difficult period. At the end, I am utterly convinced, and this is my mandate, and I will fulfill this until the last day of my time in office. At the end, we will jointly manage to vanquish this pandemic and to see better days. Thank you very much.
And that was Chancellor Angela Merkel addressing the German Bundestag, defending her reopening strategy after yesterday's announcement that the lockdown here in Germany will be extended until at least March 7th. Merkel said she was acutely aware of how difficult this lockdown has been for people and that her government's objective is to lift the restrictions as soon as it is possible. She spoke of the people who have lost their lives to the coronavirus and said politicians owe it to them to make the right decisions now. Merkel defended the slow vaccine rollout in Germany, but said she is confident things will speed up. And she spoke of her concern about the dangerous virus mutations now emerging and the challenges they pose. The Chancellor also explained that any reopening will be based on the level of infections rather than specific dates. Now let's bring in political correspondent Nina Hase, joins me now from our parliamentary studios. Nina, what did you make of Angela Merkel's speech in the German Bundestag? What stood out for you?
I think, Gerhard, one thing became very clear today. We are seeing a chancellor who is not standing again in the next elections this fall, in September. Angela Merkel has decided herself that she is not going to run again, which means, in a way, and you saw that very clearly in this speech, in this address to Bundestag, I found, that she is not under the same pressure as other politicians to sort of make compromises. She tried to convince the Bundestag politicians yet again that her ultimate goal is to not overburden the health system, and that she feels this promise that she essentially made has been kept by her and her government and by the state as a whole. So this is Angela Merkel always trying to get other people to agree on the strictest of measures possible so that we can really fight the battle against this virus and bring the numbers down. And this came out very, very clearly. And if you look at what was decided in the big round between state premiers and Angela Merkel yesterday, Angela Merkel again wanted the maximum possible extension of the current lockdown measures. She wanted them to be extended until at least the 14th of March. And there are some state premiers who are under a lot more pressure because, of course, many people want the restrictions to be lifted, and they are going to stand in local and regional elections, which are happening on the 14th of March. So people from those states that are seeing elections on the 14th of March opted for the 7th of March for restrictions to be lifted so that they could give a present to voters. That is only one of the many things that became very, very clear in Angela Merkel's address.
You know, the infection rate has been improving, though, over the last couple of weeks. How did Merkel defend and justify extending the lockdown for another month?
I actually looked at my watch, or rather at the clock here in the studio, and I wrote down that she spent 8 minutes talking about the virus and all the threats and the entire strategy. She went through all of last year again and the measures that we took and what happened during the summer when figures were low. 8 minutes before she even mentioned the mutations and the current threat. And 8 minutes she used that time to highlight all the successes. She said it was the right strategy. We fought the battle very well during the first wave. Then we had a more relaxing situation in the summer. But then she said that she wanted to have more stricter restrictions again before the second wave hit Germany. And it's true that she did warn everybody. She said we are risking a period of exponential growth if we don't take harsh measures now in the autumn. And then, of course, the state premiers decided to go the other way. So she said now with the mutations, there is a real risk that we are destroying all our successes, and that cannot happen.
Nina, I believe we have a soundbite from her address prepared right now. Let's have a listen to that.
As a democracy, it is our duty not to have the restrictions one day longer than needed and to lift them when they are no longer necessary. That is exactly the goal of the government, and I know it's also the goal of the entire German parliament.
Restrictions until they are no longer necessary, she said there. And she linked that not to a specific date that we've discussed earlier, but she linked it to numbers of incidents, how many people get infected in a certain period of time. What did she have to say about that?
Well, she is a scientist by trade, and so she knows that you need to... I mean, there are scientific models that you can use as a basis for political decision-making, but of course we are in a political situation. So the legal situation here in Germany says that you can only extend the measures by a maximum of 4 weeks before the Bundestag will have to have a say in those legal situations again. So Angela Merkel would prefer to base all the decisions that everybody is taking on the number of new infections, on certain other scientific measures. But really, she is also limited by the legal situation here. She said, for example, that she would have preferred a situation where the state premiers would have based their decision-making on, when it comes to reopening schools and kindergartens, on the number of new infections infections. But she said she's also facing the reality that state premiers, when it comes to reopening schools and kindergartens, have lots of other factors to take into account. And so she's staying out of that, and she is very aware. She said that she can't interfere there.
Yeah, not least the elections coming up for many of these state premiers. She also mentioned the vaccination strategy that has gone off to a very, very slow start here in Germany, and pointed also to Europe and defended the decision to leave the buying of the vaccination of the vaccines to the European Union. What did you have to say about that?
It is very rare when Angela Merkel uses political tools like referring to the World War as, of course, one of Germany's modern Germany's biggest trauma, essentially. Angela Merkel referred to World War II as the reference point from which onwards modern Germany decided to take all the major decisions together with its European partners. So that was very strong language from Angela Merkel in this context. She really wanted to get that message out. We're only as strong as Europe is. And so this is something where she is not going to give in to anybody who's criticizing that strategy. You have to keep in mind that Germany is surrounded by 9 European member states, so the virus doesn't know any borders. We know that the virus can travel into Germany from basically lots of places. And so Angela Merkel is convinced that the European way is the way forward. But of course, the German federal structure has also led to a situation where the vaccine rollout has been very slow. Now, there is a bit of a light on the horizon now, with more vaccines being approved, with BioNTech Pfizer extending its production facility. That news came out this week, so there is a bit of hope, but still it is an extremely slow process. Angela Merkel said, we're hoping to have made an offer to anybody who wants to have a vaccine to have been vaccinated by the end of the summer. That is still a very long time.
Nina, she also referred to the 3 new variants that are around. She called these variants very aggressive. Why did she do that, you think?
Well, to justify the decision to extend the lockdown, because, of course, the numbers have been going down extremely. We have reached levels that we last saw in October. So everybody agrees that the current measures are working, and people are calling for the restrictions to be lifted. But, of course, Angela Merkel said, we simply don't know enough about the mutations. She did say that in the last big round when she met with the state premiers a couple of weeks ago already. So there is not enough data available, but there is a real risk of this virus, like in other countries, mutating in a way that even though you have low infection numbers for a number of weeks because of restrictions, you suddenly see an exponential growth again. And that is something that she doesn't want to risk, not least because she wants to protect the health system, but also because, politically speaking, that would be a disaster as well for all the politicians who are involved in the decision-making process.
We're going to hear a bit more about these new variants in just a moment. For now, Nina Haase, our political correspondent, thank you very much for this assessment of Angela Merkel's speech to the German Bundestag.